Hi Jane, what brings you in today?
Hey, so I'm just having like this terrible pain down there. It's been going on for like a few days now. I
Okay.
Googled it and like it says it's a UTI. So
Okay.
I need
What
something.
what kind of symptoms are you having?
Well, it burns when I pee. It hurts when I have sex, and like my lower belly hurts here. And then I noticed like some weird yellow discharge in my underwear the last couple of days.
Okay. We could definitely order some tests and go from there, but I just want to circle back to what you said about when it hurts when you have sex. Are you saying that you are sexually active?
Yeah.
Okay. And how many partners have you had in the last year?
Um, like 10?
Okay. More, do you think more than 10 or less than 10?
I mean, give or take.
Okay. And are you using any protection?
Yeah, I mean, I take my birth control every day.
Okay, birth control is good, but are you using any protection against STIs?
What are STIs?
So,
Any STDs?
kind of. An STI can lead to an STD, but these are sexually transmitted infections that are spread through sexual contact. So, like bacteria and viruses that are shared between person to person and through bodily fluids.
Oh, I didn't know that.
Yeah, so condoms are one of the most effective ways to protect against these STIs, and since they act as a barrier, that stops the sharing of the fluids. So they're really good, especially if you have multiple partners.
Oh. I mean, yeah, I never tried it before. Like, I remember learning about condoms in high school or whatever, but I just thought that was like if you already had STDs and then you should be using condoms. But,
Okay.
like,
Yeah, well, we'll run some tests and we'll figure it out together.
okay. All right. All right.
Okay, so I have your rapid results, and you
Oh,
did
wow.
test positive for chlamydia, which is an STI, and that would explain why you're feeling this way.
Okay. Is that serious or what?
It can be serious if it doesn't get treated. If left untreated, chlamydia can cause infertility and other health complications, but the good news is we caught it now, and I'm prescribing medication to treat it. Do you
Okay.
have an OBGYN?
No, because I'm not pregnant, right?
No, you're not pregnant, but we'll set you up with one. They specialize in reproductive health and can work with you long term to prevent future infections.
Okay.
How are you feeling about everything we just discussed? Okay.
Whatever.
On a scale of 1 to 10, how important would you say it is to protect yourself from infections in the future?
Like 5.
Okay. And are you confident that you could start using condoms to reduce your risk on a scale of 1 to 10?
Not really. I'm not sure.
Okay. Well, this is a good starting point. I know it can feel overwhelming at first. Let's work on the small steps like connecting you with the OBGYN and learn more about protection options. How does that sound?
Sounds fine.
Okay.
As we can see in the previous recording, the patient is in what we call the pre-contemplation phase. She has little awareness that she has a problem, and she did not associate her symptoms with her sexual promiscuity. She is seemingly not engaged or showing body language that would suggest that she has concerns about her medical health. She admits to having more than 10 partners in the last year and does not use any form of protection other than birth control. She also displays a lack of sexual awareness, believing that birth control is the only necessary contraceptive. The goal is to help the patient to understand that her behavior is risky and has led to an infection that can lead to infertility. The immediate goal is to set her up with an OBGYN for follow-up to further discuss and treat her current infection. The long-term goal is to help her move towards contemplation by increasing her awareness of how protective measures can reduce her risk of STIs.
Hi, it's good to see you again. This is just a quick check-in to see how you've been feeling since your last visit. We can also go over some prevention measures and your plan to protect yourself in the future. But first and foremost, how is your pain now?
The pain is gone now. The medicine really helps. So I'm like back to normal.
Good. I'm glad to hear that. Have you had a chance to make an appointment with the OBGYN we referred you to?
Nope, not yet. I've been pretty busy, but I'll get there.
Yeah, I understand life can get busy, but it takes months to get an appointment sometimes. We can do it together maybe towards the end of our time if you'd like.
Yeah, I guess so. I mean, but why do I need to go there? Why can't I just keep coming to you every time I have an issue?
So, I'm a primary care physician, and this matter is certainly within my scope, but an OBGYN is an expert on sexual reproductive health and has much more resources to offer you. You can set up an annual screening with them and keep me for when you're feeling generally ill.
Okay, that makes sense, I guess. It would be nice to talk to an expert.
Yeah, exactly. So also last time when we talked about protecting yourself by using condoms, have you started using them with your partners?
Not really. I bought some and I brought up the idea, but the guys don't really seem to like them, and I don't mind not using them. So,
I hear you. And it's great you bought some and started talking about them. But remember how last time we discussed the chlamydia you contracted was due to sex without condoms? So how do you feel about this affecting your health?
I don't know. I don't really know what you're asking.
Okay, how about this? On a scale of 1 to 10, how important does protecting your health feel to you now?
Maybe like a 7.
Okay, that's good. Last time we were together, you said you were at a 5, so it sounds like you're considering your health more. How confident would you say you are in trying to use the condoms now?
Probably a 5.
Okay, I understand you're probably getting some resistance, but what are your other hesitations with using them?
I guess if I knew more like about how to use them, like incorporating them into the situation. Also, they're really expensive. So if the guys I'm with aren't into using them and they cost me money, like why do I keep pushing it?
I understand. Well, I have some resources I can send you that might be helpful and some free samples. And what do you think would help you feel more confident about taking that next step? Maybe we can set up some small goals together. I'm here to really support you in any way that you need.
Um, I don't know like what would help, but I mean I do know that I kind of like I need to change something. I don't want to go through this pain and this whole hassle again. And last time when I was here, you mentioned the possibility of infertility with the STI, so that was a little scary.
Yeah, I didn't mean to scare you, but it's important that you know the facts. And I'm glad we're discussing this matter now. So I think a good goal would be to use them consistently with one partner and see how that goes. And then you can talk to your OBGYN more about it.
Yeah, I mean, using condoms with at least like one person doesn't sound too bad. I can try that. And I guess then talking to the OBGYN like can't hurt either.
Yeah, perfect. Change is really hard, and making progress is all about trying and learning. So before we wrap up, let me ask you on a scale of 1 to 10, how confident are you feeling now about taking these steps toward protecting your health?
Maybe like a 6. I mean, I'm still figuring it out, but I do feel a little bit better about it now.
Good. That's progress. It's okay to take things one step at a time. Let's plan to check in again in a few weeks and see how you're doing with the condoms and if you've had a chance to meet with your OBGYN yet, and we'll keep working together. How does that sound?
That works for me.
Okay, so let's make sure we're on the same page. How about you tell me what your next steps are?
Okay. Well, we'll make the appointment. And then you'll send me some more information and some of those free samples.
Great. Yeah. Thanks for being so open with me so I can assist you with making healthy choices.
Thank you.
During the follow-up appointment, this patient demonstrated her progression from the pre-contemplation to contemplation stage of the behavioral change model. She acknowledged the importance of protecting her health and stated that she is exploring ways to reduce her risk for future exposure to potential STIs. These changes included using and learning more about condoms, as well as connecting with an OBGYN for future preventative screenings and yearly checkups. One of the primary goals from this appointment is to continue helping her build the confidence and providing resources to help her support in taking further action. We also want to reinforce her knowledge of the risks associated with unprotected sex, as well as continue providing free condoms and educational materials. These resources, along with helping her to schedule her OBGYN appointment, all promote behavioral change. Long-term goals include helping our patient feel supported enough to remain consistent when engaging in protective and preventative behaviors. This would allow the patient to move from the preparation stage and into the action stage of the trans-theoretical model, eventually resulting in identifiable change. Going forward and maintaining a judgment-free space where a patient feels safe enough to explore changes at her own pace is key for true change. In the end, by addressing her barriers and celebrating the small progress that she has made so far, we are helping our patient move closer to greater behavioral change and overall better health.